In the biggest city of Africa's most populous country, the first case of coronavirus is worrying news. An Italian man flew into Lagos, Nigeria from Milan earlier this week.
We have started working to identify all the contacts of the patient since he entered Nigeria, and even those who were with him on the aircraft.
Nigeria's large population and high rates of poverty make it vulnerable to outbreaks like these. When the World Health Organization declared the virus a global health emergency last month, it was because of concern it could hit countries with weak health systems. On Friday, the WHO upgraded the risk of the virus's global threat to very high.
And I think this is a reality check for every government on the planet. Wake up, get ready. This virus may be on its way and you need to be ready. You have a duty to your citizens, you have a duty to the world to be ready.
He pointed to the increase in cases and affected countries, some struggling to contain the virus. The first cases have been announced in Denmark, Estonia, Lithuania, the Netherlands and Mexico, all linked to the outbreak in Italy. It's reported hundreds of cases and is the epicentre of the virus outside Asia. Its famous squares are far emptier than usual and trains are being disinfected in a bid to slow the virus's spread.
The city still seems to be a little asleep, in a negative way. I don't see many people around and I'm sorry to see that people have been so alarmed.
In Switzerland, Geneva's international motor show's been cancelled after the government banned all events involving more than 1,000 people. And in Iran, instead of crowds of worshippers, there were workers in hazmat suits in this holy shrine in Mashhad. Friday prayers were cancelled across much of Iran, where the virus has killed dozens of people and infected hundreds more. China, though, where the virus began, recorded the lowest number of new cases in more than a month. More than 36,000 people have already been discharged from hospital after recovering from the disease.
The recent success in controlling the epidemic is hard-earned. The situation is still grim and complex, and with an increase of people going back to work and school, we are facing the risk of the epidemic rebounding. We cannot afford to take chances.
That warning is now being echoed worldwide. Alexi, Al Jazeera.
Let's take this on. We can speak now to Suleiman Elede, who's a media consultant, joining us live from Lagos in Nigeria by Skype. So, Suleiman, now we have this case in Nigeria. How has that news been received by people there? How worried are people?
Many thanks, Nick. Nigerians are worried, especially those in Lagos where the case was reported. Earlier today, the governor of Lagos State had a live conference where he spoke to Nigerians and Lagosians, asking them not to panic because this particular case is being addressed. But just some couple of hours, just to give you an update before I came on live with you, 28 people at the moment have been quarantined in the state so far, talking about those who had direct contact with the Italian when he arrived at the factory in a place called OGUN State, which is, a neighboring state to Lagos State. It's a cement factory called Lafarge. And the company has already shut down that factory as they try as much as possible to see those who were in contact with this man who came in from Milan, Italy.
There are concerns, as you will know, that some countries will not have the means to deal with this virus. In Nigeria, of course, systems were put in place to deal with Ebola. How helpful are those systems now? How ready is Nigeria for any escalation in the uptake of the virus?
So far, the Lagos State government has a facility that can take about 100 people. So now the man who's come down with the virus is the only one in the facility, meaning they have about 99 beds there unoccupied. For the 28 that have been quarantined, they've just been watched closely to see if they'll come down with the virus. So far, I think the medical professionals and the Center for Disease Control in Nigeria, they say they're ready. And the Minister for Health has also been speaking to people. But again, there's something that has happened in Lagos and a couple of other states and cities, and it has to do with the panic which the government has warned against. If you go to shops, and especially medical shops around Lagos in Nigeria, hardly would you be able to find a hand sanitizer to buy. And well, they've gone out of shop. And of course, the face mask is also in scarce demand. So in so many other places you go to in Nigeria, like the electricity company where I presently consult for, the company has tried as much as possible to also give out nose masks. So where we are at the moment, before I came in here to stop to take this interview, we were all giving hand sanitizer. So I think the awareness is creeping on the people, coupled with the panic, which people trying to liken it with the fright and concern they had when we had Ebola. As you rightly said, Nigeria was able to manage Ebola, so the doctors here, they say they're also ready. But so far, there's just one man down with the virus, while 28 at the moment are in a facility being washed.
All right, excellent. Thanks for that update. That's Suleiman Elede. Thanks a lot.